Hello, I'm Dr. Ramya Mishra, working as infertility consultant at Apollo Fertility, New Delhi. See, IVF is a procedure which has got a full form as in vitro fertilization, wherein the eggs are taken from the female partner and it is fertilized with the sperms from the male partner so as to give rise to the embryos. So that is the procedure which is called IVF, because usually the fertilization happens in the fallopian tubes. But in case of IVF, we proceed for the fertilization outside the body in the lab, and that is done specifically for those couples where the sperm parameters are not good, or we find that the sperm is not having a good motility, or if there are sperm morphology issues. So they are specifically chosen from there and then they are injected in the body. But we all know that the process of aging, which is a natural phenomena, does happen in everyone. So ladies have to give importance to the biological clock which is ticking in all of us. Normally, when a female starts aging, the egg reserve goes down. So this happens usually from 30 years of age. So we all have to keep in mind that if we are pushing our pregnancies or our conceptions, then we should have a look at our fertility status, especially in case of females. In case you have got your partner's sperm parameters which are not good, the sperm count is less, the motility is less, or the morphology is not good, in these conditions also you can utilize the process of IVF and get a progeny of your own. See, earlier there was no limitation for the process of IVF to any age group, but recently in India we have come across with the ART law which restricts the process of IVF in case of females after the age of 50 years, right? In case of males, the upper limit has been taken as 55 years. Initially, there was a very big question in everybody's mind that no, I will not go for IVF, I will go for IVF as the last resort. I would say don't think this is the last resort. Getting a procedure done at the right time is very important, because IVF has also got some limitations. Like I told you, we have age limit in the female partners. So if your egg reserve is falling down at a faster speed, that is even at a younger age of 25 or 26 years, then also you can think of the procedure. If your husband parameters show azoospermia, in these kind of conditions also we should not delay it much and we should get the procedure of IVF done. If you have got blocked tubes, then of course you should think of the procedure of IVF, because this is certainly not the last resort. Because if that mindset is there that I will be using this procedure in the last only, then you sometimes lose your precious eggs and the chance of getting a progeny of your own gametes also gets bleaked out. So if you have got a result which indicates that you have got a lower egg reserve or your egg potential is less, in that case one should think of the procedure of IVF, or at least going for egg freezing if you don't have a partner which is still you have chosen, right? Okay. If you have got severe PCO, in these conditions also it becomes difficult for the eggs to mature at the right time. So there also you need to get the help of IVF and prepare the eggs, get them out from the body and fertilize with the husband's sperm. I'm very happy to let you know that recently Healthtrip has come up with this initiative of helping our overseas patients, to ease out the process of getting the IVF done in India. They can definitely help you out in carrying on the consultations with us one-to-one, so that you know about your particular case, and after consultations only, or after getting the in-depth knowledge of the procedure which is to be done, what is the time of stay, what is the expected cost of the treatment, this all you can let us you can get an insight from them, and they will be definitely helping you out. Thank you so much, Healthtrip, for coming up with this platform.